We are tired. We are emotionally and physically tired.
Speaking from the front lines of the COVID-19 pandemic at Dell Medical School, Dr. Shalaja Hayden explains the toll caring for Austin's sickest patients is taking on hospital staff.
What we're seeing is like a house fire. I mean, the suffering, the magnitude of suffering in the ICU right now is like nothing I have experienced before.
Hayden says as a doctor who specializes in the respiratory system, she cared for Austin's first COVID patient in March.
And pretty much every single day since then, I have either taken care of COVID patients, mourned for COVID patients that we have lost, and worried about this nightmare scenario in which we truly are overwhelmed.
Austin's interim health authority, Dr. Mark Escott, says the numbers are currently trending towards a situation in which hospital staff will be overwhelmed. And although Austin hospitals have been able to help areas like West Texas when they ran out of room for patients, we can't rely on them to return the favor.
Since all of our surrounding metro regions are also in bad shape, there may be nowhere to transport anybody. And we may wind up in a position where we're having to use less experienced staff in makeshift rooms. And that's a nightmare none of us want to come to.
A spokesperson for Austin area hospitals sent us a statement that reads in part, quote, "Currently, Ascension Seton, Baylor Scott and White, and St. David's Healthcare have sufficient staffing and capacity to care for both patients with COVID-19 as well as those with other medical conditions. However, similar to the weeks following Thanksgiving, we're beginning to see an increase of COVID-19 cases in our local communities and in our hospitals following the recent holiday gatherings." Dr. Hayden begged young people to take the threat seriously, take precautions, and stay home whenever possible, even during holidays. Because while younger people have a better chance of recovering from the virus, that's not always the way it goes.
The youngest patient that I have personally lost to COVID-19 was 25 years old. And that's not something I ever want to see again. And so I would really, put out a plea to the young people that a virtual holiday celebration is kind of lame, but a virtual funeral is heartbreak.